Hello, how are you? Welcome to Public Health Matters. My name is Iraida Munoz, and I work with the Public Health Department here in NASHUA, New Hampshire. And I'm here with Nurse Jacques, Josephine Jacques. Welcome.
Thank you.
Welcome to your show, your space, right here. We have a very interesting program today. Talking on behalf of Bobby Bagley. She's taking some time off due to other commitments, and I'm happy to substitute for her. We want to talk a lot of things. First of all, I want to say congratulations on Nursing Week, Nursing Month. We want to congratulate everybody, every nurse that is out there serving their best and doing their best for the patients.
Yes.
It's very important, the role that a nurse plays in women's and men's health, everybody's health. So thank you for your service.
You're welcome.
But I want to hear a little bit about you. We have been speaking a lot lately. You were with us last week in our radio show as well. And we were talking about different subjects. And there were a lot of subjects that were related to prevention. But before that, I would like to hear a little bit about your story and what were you sharing with us last week. So tell us about Josephine and how Josephine became interested on this field.
Hello, everybody. Happy Nurses Week, like you said. I am originally from Haiti. So I grew up in Haiti, Caribbean island next to the Dominican Republic. For those
very
of you
close
who might
to
not
my
know.
island,
oh, that's
too, from
your
Puerto
island.
Rico.
Okay, yeah, I know. And I moved to the United States when I was 18, or should I say my parents brought me there to Florida. And I did my last year of high school there. So I've always been interested in healthcare for some reason in Haiti, and it's an impoverished country where people do not really go to the doctors until they are sick. And I've lost family members. I lost my aunt when she was only 39.
I'm sorry to hear that.
Yeah, for things that could have been prevented. And, I've watched, people, I've watched students from my school dying. I've gone to funerals of students, very emotional. And I have always been searching for solution. How can we fix this? How could this have been prevented? So I definitely knew that I was going to be in the health field at some point. So when I got to Florida, being a nurse was quicker and more affordable for my family. So I wanted to be a doctor, but I'm like, you know what, I got to be realistic there. So what's going to get me, maybe I can pursue more studies later on, but what was going to get me on board to at least start doing something about healthcare? So it was nursing. So I went to a community college and I did my associate degree as a registered nurse there. And then later on, I went back to school and became a nurse practitioner. But I was a registered nurse for 20 years before I became a nurse practitioner. I got married in the meantime. I had children in the meantime. And then I went back to school when the kids were like 10 and 11 years old and did part-time. So it took me forever to do it, but I completed it. Yeah. But as a registered nurse, I was always talking to my doctors when I was getting orders from them. A lot of times they would tell me, why don't you go be a nurse practitioner? Because I would call a doctor and I would tell them what to order for my patients. This patient has this and that. And can you prescribe that? And a lot of times they'll say, oh yeah, I'll prescribe that.
So you were telling the doctor what to get, okay.
So yeah, so I've seen some of them telling me, what? Yeah, that's exactly what I would do. Go ahead and do that. And they would say, why don't you become, one of us? So yeah, so I was, encouraged by that.
Yeah, there's always some sort of compassion that someone has to feel in order to join this type of field, right? But it also requires a lot of effort to go to school and to make all these requirements. So what would you say to someone that is thinking about it, but not necessarily taking the steps to become a nurse?
Right. Well, I would say to take it one day at a time. Don't look at the whole picture yet, like I did, I'm like, I have a goal, but, I'll just plan on achieving what I can achieve right now, and then I can move forward, you know, as life allows. So that's what I did. I became the nurse practitioner the nurse first. Yeah. And
some people start as an LNA, right? Like
starting. And while I was a student, I never really took LNA classes, but while I was a student, there was a hospital that hired me to be a nursing assistant, so that get me, you know, in the field, I could follow nurses and see what they do, and that was a good learning experience too. So I'll tell people, don't ever underestimate a nursing assistant, because, you know,
exactly. It is hard work. Potential. It is hard work starting from the bottom and seeing.
Right. Sometimes we don't want to do that, but it's very good. The experience that you get as a nursing assistant, you know, it sticks to you, and you do better when you go to nursing school.
Yeah, exactly. And tell us a little bit now about your practice, because I know that you have a practice here in Nashua, New Hampshire.
Right. So about 5 years ago, I decided to go on my own and open up my own clinic. When I was working, I mean, it was good experience, but when I was working for an agency, you know, corporate health, I felt like I was always rushed to see clients one after the other. It's almost like a factory line. And I am a talker, and I'm a teacher, and I'm laid back. And I felt like I was not really doing a good job, because I was not given the right time to see a client. So I'm like, that was another goal that I have. I said that someday I'm going to have my own practice where I don't have to see anybody for 15 minutes and get them out of the door. I can stay with them for 30 minutes. So right now so I opened my own practices, and my clients are always given 30 minutes. If someone is rushed, sometimes people will rush themselves, so then, you know, they can go. But I keep them for at least half an hour. Okay. So we can talk about, you know, and I don't look at just one thing. I look at the whole person, what's going on in their lives, because sometimes people have high blood pressure because of stress. They have things because there is a root cause to that. So I always like to look at the root cause, and to be able to look at the root cause, you have to have the time. So so that's what I do, and I primarily do a lot of prevention. I encourage everybody to always have a yearly physical where we can do blood work and see if anything is going on. We try to catch it at the earliest stage or before it even happens, so we have a better chances of treating or even surviving. Because, you know, we have like cancer, a lot of times if people were doing their pap smear every year, they could have caught that cervical cancer or endometrial cancer, something like that. So it's good to just do things to prevent things.
Like being aware about how are we feeling, and just paying attention. Sometimes we are so busy doing the day-to-day things, and we just don't pay attention to what's going on in our own bodies. So what is your typical patient? What are you seeing in your practice more often? What type of patients do you see more?
I see, like age range, I have a few children under 5, but most of my patient population, they are between 20 and 110.
Okay, all ages, that's good.
Yeah, and I also, right now, I also offer some services at an assisted living, so I go visit clients at the assisted living. So I said 110 because I did have a client who died last year after she turned 110. So that was my oldest.
Okay, well, that was a long life.
Right. So yeah, so I see people like that, like in their 20s when maybe they don't have anything going on yet, but like I said, I encourage them to get their physical, and I do find a lot of people in their 20s already having vitamin D deficiency, because we live in New Hampshire where there's not much sun. So that's one thing, and a low vitamin D can cause low mood like depression. So people don't know that. So I've found, people in their 20s and they feel like their mood is low. They don't know why. And when we check vitamin D is low, then I just put them on vitamin D supplements and they see a difference in their moods.
Like the seasonal depression, what we call it, seasonal depression.
Right, exactly. So, but just taking the vitamin D supplement can contribute to someone feeling more alive and feeling, up to getting out of bed and going to do their business because of, So, and then my elderly population, unfortunately, a lot of them have caught them at their old age, so they already had high blood pressure, they already have diabetes and high cholesterol, and the cancer survivors, so they have things already going on. But then, I still try to keep up with preventing this from getting any worse. Whatever we can correct, we try to correct. Whatever we can prevent in them too, we try to prevent. So.
And you were talking to us last week about some interesting treatments that you're doing at your facilities now that are innovative. Tell us a little bit about that.
The new treatments, okay.
Yes.
So this year we have introduced actually 2 different new treatments. Is a hair loss treatment, because I find a lot of women in their menopause age, or sometimes even after they've had kids, who are losing hair, and I have people coming with baldness, like bald spots, and which is really causing a lot of depression in them, because as women we like to have a full head of hair. Even if it's short, some people like short hair, but they still want to see head of hair. So we have decided to introduce machine that gives you an ultrasound therapy. It massages the scalp. It's like an ultrasound massage to the scalp, and it revives the follicles to start producing hair again. So we are seeing women and men, but mostly women are interested in doing that. Getting their dues back from this machine. And we have also introduced a weight loss program. So we always encourage people to do lifestyle changes, because we in the United States, we have salads available, we're not just eating to survive. Like I know in the islands, sometimes people just eat rice because they want something that fills them up because of lack of finances or poverty. But in the United States, we can afford salad, we can afford fruits. So it's good to, I always encourage people to do those anyway, but some people are really already at a level where they would need bariatric surgery. We are doing the semaglutide shots along with the lifestyle changes, because whatever you do, if you don't do lifestyle changes or lose weight, you're gonna gain it back. So it's good to always look at, sleeping the proper amount of hours, going to the gym, and walking counts. I tell people walking counts. And in the Spanish community, I tell a lot of my Spanish people, well, if they like dancing, I say, well, go to the nightclub, salsa.
That's something that we are always encouraging folks, especially, as you say, the Spanish speakers. They are constantly looking to move around, and they are happy people, and they enjoy it.
I tell them
only if there's music involved.
It's a merengue and salsa. That's good exercise. You don't have to go to the gym if you're going to.
There you go. Just go to the club.
So.
But diet, right? Like the nutrition piece of it is also part of the prevention, and the prevention piece that you're talking about alongside with the medication part that you're talking about.
Exactly.
So those are the topics, the hot topics at your clinic right now, right?
Those are the topics at the clinic right now, Everybody's looking forward to something good that would elevate their mood. And this week is also mental health awareness.
Correct.
So people get depressed when they cannot fit into their clothes. They gotta go buy new clothes.
All of us
get depressed. Women get depressed when their hair is falling, and So that helps.
It's never one thing, right? So it's always a combination of things. And that's what I often say. To make us feel better is always a combination of changes that we have to put together. So I'm glad that some folks are looking for that help already in order to achieve those goals and seeking for that professional help in a clinic that is so needed. But some others that have not making those decisions to find that help and they are still hesitating or thinking about it, I encourage everybody to really start looking into more information and finding those professionals who can really guide a person towards their goals. Especially, as you say, Mental Health Awareness Month is the special opportunity that we like to talk about it. But we talk about mental health all year round, right?
Right, exactly.
We like to educate folks all year round because mental health, everybody has mental health. And especially this month, we focus on it because there's so many intersectionalities. But yeah, self-care is so important, right? Especially on the times that we're living.
Yes.
And feeling good when you see yourself in the mirror is also part of it. So everything that you're saying makes so much sense. When you see yourself in the mirror and you're losing hair, that's probably not something that people enjoys, right? So due to stress, right? Due to some anxiety, due to some other mental health situations going on. Maybe some people is struggling with other circumstances that are causing that hair loss. So that's when it's so handy, so important to seek for help.
Right, exactly. So when someone comes to us for hair loss, we don't just look at, okay, are you losing hair? Let's just give you a treatment. Like I said, we look at the underlying causes, the root causes of it. So I always check to see, well, when was the last time you had a physical? Did you have any blood work with that physical? Did they check your thyroid? Because some conditions like a thyroid disorder can cause people to lose hair. And did you have anything that has to do with hormones? Did you just give birth to a baby? Unfortunately, some women, after they give birth, they end up with alopecia. So we look at all those circumstances. Are you getting proper sleep? Sometimes when you don't sleep, you know, then we lose hair, we gain weight. So we look at, you know, all the different factors and see how we're going to treat those associating or underlying factors along with treating your scalp, because we're not just going to give you a scalp treatment and then you go and then you don't change anything else.
But I feel like, as you were saying before, women, especially and the menopause and the perimenopause and all the changes that we're having as women are affecting our bodies all the time. So we never know where we are in our cycles that are affecting us.
Some diseases too are silent killers. You don't have any symptoms until it's too late. Like high blood pressure is a silent killer. Some people have high blood pressure for years and they never knew it. So that's why it's important when they get a yearly physical, at least that blood pressure is checked once a year and they can see where it is at. And it's, you know, it's manageable and it's even treatable. If you, sometimes a little bit of weight loss might, you know, bring you back to a regular blood pressure level or regular blood sugar level. I see people losing weight and get off the medications for blood pressure and diabetes sometimes. So
and it's incredible how people, you know, and all the issues health issues that people have for lack of sleep as well. And the mental health situation alongside with the lack of sleep, we have seen so many people struggling with their health as a cause. One of the causes is lack of sleep, or mental health. So what are some remedies that we could do when we are struggling with those situations? What would you do with a patient that brings this kind of issues to you?
So I would look at, you know, what's causing the lack of sleep. I know sometimes some of us are shift workers, you know, in nursing, a lot of nurses are working at night. So that throws off our sleep patterns. I know I worked nights at some point in my career, and I would go home and because it's daytime, and start cooking, cleaning the house, doing my laundry, doing all my chores, and neglecting to sleep until I started feeling it. So I would tell people, if they work nights, you know, when you go home, you know, you go to your bed, you know, pull the shades down and make the room dark and get your sleep. And once you awake, then you can worry about paying the bills, you can worry about cleaning, cooking, and do all your chores. So that's one thing that we can do for insomnia. And then other than that, we have now with the social media, screen time, that's kind of a big thing that causes people not to sleep. It's 12 midnight and people are still on Facebook posting, and everybody wants to know what's going on in the world there, in the world of their family members and friends. They want to see what's, but then there is a time when you should probably 2 hours before your bedtime, maybe just shut off on the social media, on the screen time, and concentrate on, okay, I'm getting ready for sleep. And don't drink caffeinated drinks, definitely. It's not time to have your coffee when it's almost bedtime. So all those good habits are things that people can do to regain their sleep back. And if you're into meditation, or, you know, just take some time for yourself, and do not make a list of things that you gotta do in the morning, you know, and get yourself all stressed out. So like I tell people, before the day is over, if you're gonna make a list, make it, you know, at least, you know, before you leave work. Okay, I didn't get that done, I'll get it done tomorrow, and then leave it there. Sometimes we bring work at home. It's not a good thing. Or we bring things that are happening at home to work. So I tell people, always pretend that there is a basket. There is an invisible basket. At work, where you pick up the things that you're going to be doing at work from that basket when you go in, but when you're leaving, you leave them there in that basket for the next day. And then I tell them, do that for home too. You got those 2 baskets.
That's a great advice. I like that basket situation, because sometimes you wake up like super early in the morning, like this is my personal experience. I start thinking about work at 5 a.m., 5:30, even without opening my eyes, I am already thinking about work. Right. So it's decreasing my amount of sleep time, right? So really, I can relate to that.
Have your invisible baskets there, basket for work, a basket for home, and you put and pick up.
I like that, the basket analogy. I'm gonna keep it for myself. Thank you for that advice. Anything else that I haven't asked you that you I've seen more often in your practice that you want to bring to our attention, related to mental health, related to your practice, prevention, which is to us super important in public health?
So one thing I tell people, we live in a society where, you know, there is a lot of isolation. People are isolated at home. People don't know who their neighbors are. So I tell people, if someone moves in the neighborhood, you know, and a lot of people welcome. I do that myself. I have neighbors, and someone moves into the room, into the neighborhood. You know, I go bang at the door, say, I'm the neighbor next door, and you know, if you ever need anything, this is my number. Call me, and you know, I introduce myself, and people always appreciate that. I've never seen anybody who says, "Oh, I don't care." You know, you always. They might not do it. They might never. Yeah, I know. Many neighbors have said that too, but I never see them. They, you know, they don't want to bother me, maybe. But at least, you know, you offer that, and then find a place to find a community, because we should have a little community in our lives. Leading a personal life, to me, it's really not good. We should have a little bit of community. So find a place to go and commute with other people.
Right, connecting with others.
Connecting with others, yeah. So like that's why now Facebook, you know, a lot of people are communicating there. So it's therapeutic for them. But in-person community too is pretty good. I know people say I'm introvert, but I feel like everybody needs a little bit. You might not need a big crowd, but you know, need to have a good friend that you can call sometimes and share your thoughts with. So I feel like people keep things inside, and then they die with it. But if you have at least one person that you can trust with something, you can call that person and share something with them. So for mental health, definitely I highly recommend that.
Yeah, some people, we know in public health especially, some people really hesitate to visit their PCPs or finding some health assistance because of lack of insurance or because of their financial status. Or so we're oftentimes seeing those cases. Is your practice doing something in those cases? And what can we do with those patients that need that help?
Well, right now I take everybody on for that first visit, even if they don't have insurance, and I try to find in the area. So it's a good connection for me to know about Bobby. I try to find, how they can get, you know, some type of insurance.
Yeah.
But I don't reject anybody. If somebody came to me and says, oh, I have no insurance and I cannot even pay you, I'll at least check the vital signs that day. I'll check the blood pressure, and it's okay. You can go on. Yeah.
And help them connect with public health, with us, to situate them in a way, to find a way to connect them with a provider. And not just leaving them without the service, right? Because that people is the one that really needs the help. So
Yeah.
It's important that if you don't have insurance, so you understand that public health is never going to discriminate against that. We're going to find ways for folks to get those services. We have clinics at the office, and we do see underserved folks with no insurance or with lack of insurance, and also children. So we do have services, and we connect them with those facilities that will help them as well. So I really appreciate you, and I appreciate all the work that you have done with our communities and our population. If people wants to find you, where can they find you? What's the name of your practice?
Okay, the name of my practice is Fountains of Health Primary Care, and it's located at 7 Taggart Drive, Suite E in Nashua. It is off DW Highway right next to Best Buy. And our phone number is 603-943-8923, 603-943-8923. And hablo un poquito de español, I should say that.
Oh, that's a good thing. That's a muy bueno that there's some languages welcome.
Yeah, so sometimes I can at least, is
there any website that they can check it out?
Fountainsofhealthprimarycare.com.
Perfect.
Is the website.
Thank you so much, Josephine, for being here with us. I'm Iraida Munoz, reminding you to have a great day today and a better day tomorrow. And I'll see you next time when Public Health Matters. Have a good one. Bye-bye.